Hey, thank you so much for your interest in the recording of my presentation about managing diastasis recti and urinary incontinence with exercise. I did this presentation at my local, just neighborhood playground with a couple of moms. So you'll see kids running around in the back. Audio is for the most part pretty good. A couple of times some wind passed through, but you can still hear everything. However, at the end of the presentation, the microphone really didn't pick up on the questions at all. So I just edited the film to sort of end there. But if you have any specific questions or overall general questions, please feel free to reach out to me, whether by email. My email is mcarol, spelled MKAROL, at homefrontdpt.com. You can call or even text, whatever's convenient for you. My number is 910-520-5962, and you can get all this information either on my Facebook page or my website, homefrontphysicaltherapy.com. But I hope you can get some good information. If you are interested in having me come to your neighborhood or community group, mom group, anything like that, whether it's outside on a playground, in a community center, even in your own home, I would love to come and bring this information to anyone who needs it, answer more specific questions, even go through demonstrations. After the presentation, the moms that were there, we kind of went through the different tests because everyone had a couple of questions of like, oh, test me, do I have this? So I would be glad to do this live and in person. But if we're not able to meet in person, I hope you get some good information from the recording today. Thank you. Good morning. I am Megan Carroll with Homefront Physical Therapy. Homefront Physical Therapy offers in-home mobile physical therapy, and I started the company because I had so many friends and patients who were moms with young kids that just had a really difficult time coming into a traditional clinic setting to get the care that they needed. And that was even pre-COVID times when you were actually allowed to bring kids in, but of course they were jumping on the trampoline, jumping on the treadmill, getting into all the stuff. So I just really kind of saw this need of providing in-home care so that the kids could be doing whatever they needed while the mom received the physical therapy she needed. So today I'm going to be talking specifically about diastasis recti and urinary incontinence, sort of with exercise, but you can substitute exercise for just any activity because lifting the kids on and off a swing, lifting the laundry, carrying in groceries, all of that, is basically a form of, sort of quick exercise and can put a lot of stress through your abdominal wall or through your pelvic floor muscles and cause issues if there's some instability there. So both of these are really, really common, so much so that unfortunately sometimes a lot of doctors, if you complain to them about like, hey, I'm just having a little bit of leakage, like when I sneeze or anything like that, they're like, yeah, you've got 3 kids, like what do you expect? But just because it is common does not mean it's normal and it's acceptable. So we really need to kind of change all that. But just to kind of give you a little bit of sort of how common it is, there's a lot of studies that show by later stages of pregnancy, like 35 weeks or later, 100% of women have diastasis recti. And some will just sort of come back together on their own, no intervention necessary. But about 30 to 40% continue to have that separation, maybe 6 months or even several years postpartum. And we just don't have a good understanding why some people need intervention and other people don't. There's a lot of factors to that. And then for urinary incontinence, so huge range of ages, but like for adult women ranging from like 20 to 60 years of age, 60% of adult women have had some form of urinary incontinence. And it's not just women, it can happen with men too, but usually less frequently, only about like 10 to 20% in adult men. And even with diastasis recti, that's also not exclusive to women. Men, even children and infants can have that as well, but we just sort of commonly associate it with pregnancy because it's just so common with pregnancy. But there's a lot of things that can kind of go into incontinence. So certainly pregnancy puts a lot of stress on that pelvic floor regardless of delivery. So even if someone had a cesarean delivery, you still had a lot of stress on that pelvic floor muscles the whole 9 months prior leading up to that. That can cause a lot of just sort of stretch through the muscles, weakness through those, and then certainly a vaginal birth puts a lot of stress and strain through those muscles needing to recover. But even things like just repetitive stress on the pelvic floor. So if you're someone who always bears down as you go to lift something heavy, or you have chronic cough or even chronic constipation, a lot of those things can put a lot of repetitive stress through those muscles and can lead to some incontinence issue. So what exactly are these things? So diastasis recti, the rectus abdominis is sort of what we think about, that six-pack ab muscle, and it runs the length of the abdomen, and there's connective tissue sort of connecting those two sides together. And then obviously during pregnancy everything expands forward, and so that separation needs to occur to accommodate the growing uterus, growing belly. And so sort of to get the diagnosis of diastasis recti is a partial or a complete separation of that connective tissue called the linea alba down the center, and we'll go through how to test that for sort of what's considered a significant width or not. And then urinary incontinence is actually any unintended urinary leakage. So I feel like we're all so common to say like, oh, I mean, I had a really full bladder when I sneezed, you know, it was just a little bit. I'm not incontinent, it was just kind of that one issue. Or I was lifting something heavy, or I just like didn't get there fast enough to the bathroom. But really, any incontinence is any unintended leakage. And so certainly, you know, if it's not that frequent, you might be an easy fix. But if it's occurring frequently, then it's definitely sort of something that warrants getting looked at. So there are several types of urinary incontinence, but sort of the most common two that we're going to be talking about today are stress urinary incontinence and urge urinary incontinence, and then commonly sometimes there's a mix of the two. So stress urinary incontinence is when there's pressure, sort of downward pressure through the abdomen, on the bladder, on the pelvic floor, resulting in that leakage. So a sneeze, a cough, a jump, lift, running, things like that, just sort of putting that downward pressure, and then the muscles of the pelvic floor just don't respond fast enough or strongly enough to keep the urethra closed when that bladder has that pressure on it. Urge urinary incontinence is when you kind of are like going about your day and you get that sudden, really strong urge to urinate right now, and you just can't get there fast enough. So that kind of has a lot of different causes to it, but sometimes it's just a matter of that we've sort of trained our bladder that way. The bladder is very, very trainable. So what should happen is when our bladder is about a third of the way full, we get that first signal to our brain, you know, saying that we might need to go to the bathroom soon, and our brain's like, no, I'm busy right now, I'm giving a presentation, just, you know, keep filling up, we'll get to you later. But if you kind of always go to the bathroom on that first urge to go, or you have certain things that are associated with, so sometimes people call it like key in the door, you know, symptoms. So like as soon as you're home, you're like, I gotta go now. So you've just sort of trained your bladder that every single time you come home, you immediately go to the bathroom. So the bladder associates, as soon as we're home, we're gonna go. So we're just gonna go ahead and start releasing ahead of time. So again, sometimes it's just a matter of habit training and, you know, sort of seeing some of the things that are influencing that strong sudden urge, and why your brain or your muscles aren't accommodating fast enough to say, no, just wait a little bit longer. So pelvic health physical therapy, physical therapy in general, for anyone who's not familiar, is addresses our movement patterns, any injury, condition, symptoms that interrupt our day-to-day activities. So it's really focused a lot on muscles, joints, ligaments, movements, behaviors, things like that. And pelvic physical therapy is just a specialized branch with specialized training of physical therapy to address the muscles, ligaments, and joints in your pelvis. So your pelvis requires the same amount of attention as your shoulder. So if you had a shoulder issue and it hurt every single time you lifted your arm, your doctor wouldn't hesitate to send you off to physical therapy to go get it addressed. But for some reason, just kind of the personal issues with our pelvic floor and everything that's associated with that, you talk to your doctor about an issue there and they're like, yeah, just live with it, just figure it out. Oh, it's fine, you've had kids. They kind of get it brushed off. But that is a functioning part of your body just as much as any other part. Alright, so how do you know you have these things? Obviously we've talked a lot about what it is, so it's probably a little bit obvious, what you would be feeling, but specifically for diastasis recti, you might actually see or feel like a doming in the midline of your abdomen, or maybe even a gapping, kind of when you do something, there's almost like a canyon, like right there, in the middle of your stomach. So either that doming out or that gapping in could be a sign that you have some separation there. You might just feel very unstable. So anytime you go to like sit up from the floor or lift things, you just don't feel very strong and stable, more so than like, oh, I just haven't been working out in a while. It just really feels unstable there. You might actually even kind of feel like you're falling out of your abdomen, that everything's just kind of, going forward. How to test for diastasis recti. So when you're laying on your back, knees bent, feet flat on the floor, you just lift your chin up towards your chest. You can even kind of lift your head and a little bit of your shoulders, almost like you're doing the beginning of a crunch. And then as you do that, you take your fingers kind of right in your center, kind of starting at the belly button is a good starting point. And you should feel those muscles tense underneath your finger. Now, as you're right there, if you feel like you can just sink your fingers in, then that tells you that you've got some separation there. And so you're just going to take and sort of decide, is it just one finger width that I can feel the muscles on either side, 2, 3, 4, even 5, kind of how wide does that separation go? And anything wider than 2 fingers is sort of considered clinically significant, that it kind of requires a little bit of a look at, or maybe some exercises to kind of help draw things together a little bit more. You want to assess all the way up and down your abdomen, so those muscles run from the bottom of your ribs all the way down to your pelvis. So starting at your belly button is a good starting point, but then run your fingers up, run your fingers down, because there could be a separation up at the top, but everything's closed at the bottom, or vice versa. It could be sort of open at the bottom, but sort of a good closure at the top, or it could be completely separate, all the way through, or just at the center. So it might not be symmetrical all the way through. So just kind of going through, sort of feeling where are all those soft points where I just kind of sink into my abdomen. How wide is it, top, middle, bottom, or is it a little bit more firm in one spot versus the other? So how do we actually engage and train these muscles? Now we'll kind of throw a quick caveat in there. We're going to talk a lot about strengthening, because a lot of these issues do warrant some sort of training of those muscles, but sometimes overtraining can be a part of the issue. So if I do 1,000 bicep curls and chest presses and pulls and really kind of overdevelop my chest and biceps, everyone kind of knows this, with like big old bodybuilders, then all of a sudden they can't reach behind themselves to take care of things. So a muscle has to go through its full range of motion, all the way tight contracted and all the way relaxed. So for some people, if they've been, they read online, Dr. Google knows all, do 1,000 Kegels a day. So they just squeeze all the time. And those muscles are so tight that now they're starting to have incontinence, because their muscles are in spasm all the time and not functioning the way they should. So the muscles of the pelvic floor should be able to contract, but should be able to fully relax as well and go through that full range of motion. And a good way to sort of know, sort of a good key or clue into if those muscles are too tight, or if you're having like tailbone pain, back pain, hip pain, or even pelvic floor pain, with insertion of a tampon, with intercourse, things like that. So if those things hurt, those muscles could be in spasm and sort of not allowing the passage, whether in or out, through that area. So how to actually engage the muscles of the pelvic floor, and commonly we sort of know them as Kegels, due to Dr. Kegel sort of first inventing or sort of discovering all of this. So you should sort of tighten those muscles as if you were going to stop the flow of urine. So you were sitting on the toilet and you just wanted to squeeze, and you could completely stop the flow of urine and then start again. Don't do that every single time you're on the toilet, because again, we want those muscles to relax, but it's a good quick test. Sometimes if you're sitting down, sitting up nice and tall, you can even sit on like a ball or a rolled up towel to give you a little bit more pressure sort of through those muscles. As you engage them, you should feel them lift up and away from what you're sitting on. Now, common compensations, because our body is always so useful in trying to help out as much as possible. So sometimes when people are trying to engage the muscles of the pelvic floor, they're actually squeezing their butt muscles, or they're holding their breath, or they're squeezing those legs together, because all those muscles kind of work together as they should, but you don't want one group of muscles to try to do everything while the other muscles are just sort of failing at it. That's why, again, when we kind of go to sneeze, we kind of squeeze our legs together to kind of give that pressure, use those adductors, those muscles on the inner thigh. But if the pelvic floor muscles aren't doing their job, it's just not going to be good enough. So make sure you can isolate those and you're not engaging other things. The pelvic floor muscles are 70% endurance fibers, so all day, every day, they're kind of holding up against gravity. And then about 30% sort of called fast twitch or power muscle fibers, where they can respond really quickly. So again, on that sneeze, cough, that they really activate quickly. So when you're practicing these exercises, you want to make sure that you can squeeze and hold for a full 10 seconds without losing power as you go. You also want to be able to go from fully relaxed to all the way engaged, fully relaxed, all the way engaged, aiming for about 10 of those in 10 seconds. But again, it's key to be able to go through that full range and not at the top just squeeze, 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 squeeze. So you want to be able to sort of do both kind of a quick power move as well as a long endurance hold. As for the abdomen, typically in therapy, I'm really kind of teaching people to activate their transverse abdominis, which is what wraps sort of front to back. You can kind of think about it like your internal back brace, like you're sort of strapping it on as you're about to go do something. So with that, because a lot of us tend to be sort of rectus abdominis dominant, everything we do, that six-pack ab muscle really kind of kicks in and overpowers all the other muscles of the abdomen. So with that, a good trick for anyone who's sort of having difficulty sort of finding and telling those muscles what to do is if you blow out, almost imagine 100 birthday candles in front of you, and you try to blow out every single one in one breath, you'll start to feel those muscles in the abdomen engage. You'll feel like a narrowing, a drawing in through your abdomen. And if you have a hard time feeling that, just keep going. Try to get like 120. So, and as you get to that very last edge of your breath, like you can't breathe anymore, you should really, really feel those muscles of the stomach engaging to do that. And then a lot of times once people kind of feel and discover those muscles, I try to work with them on how to engage them just sort of on command. Like we're going to do an exercise of like, okay, engage those muscles and then lift. Engage those muscles and then squat. So you can be able to kind of activate them whenever you need. But that's a good trick to kind of get started. Again, our body is so smart and tries to help out in other ways. So common compensations for that is again sort of that Valsalva, that bearing down, holding our breath, which is actually sort of pushing out and creating pressure through the abdomen. Or sometimes I'll see people like just sort of suck it in, so their ribs flare out, trying to just sort of use the diaphragm to create a seal through the abdomen versus using those muscles through the abdominal muscles to create that squeeze. All right, so if you are a part of a fitness routine, trying to get back to a fitness routine, or again, just kind of in your day-to-day life, these are some tricks to kind of modify what you're doing until you can gain the strength, stability, endurance, coordination, all the things that you need to control the stability through your abdomen, stability through your pelvic floor. So by no means am I saying to stop what you're doing. You just want to make sure you're listening to your body. And I feel like it's so easy to see it in other people, especially our children, and it's sometimes, again, easy to pass off in ourselves. So if you had a child who was, playing like Little League softball or baseball or anything like that, and they just in the past 2 weeks got enough strength, power, coordination to get their pitch all the way from the pitcher's mound across to the pitcher and across the plate, there's no way you would let that coach put that player in for an entire game and say, every single pitch, I want you to throw a fastball as hard as you can, every single time for an entire game, let alone an entire tournament, no one would be shocked if that child came back with issues with their shoulder or issues with their elbow or something else. And you'd be like, that was too much. They didn't have the strength to do that. Yet when our body is telling us it's not strong enough to do something, it's leaking, it feels unstable, we're like, yeah, but I just have to get the laundry done. So you have to kind of listen to what your body is telling you and modify as needed until you can gain the strength to be able to perform those tasks. So easy things to do is reduce the load or the weight. So obviously if lifting like 20 pounds causes some symptoms, kind of break it down to maybe 2 sets of 10 pounds, maybe taking more trips of carrying in, grocery bags from the car into the house versus all one load. Or certainly if you're doing exercises, reducing how much your weight you're using with the squats. Again, kind of more so in an exercise mode, but reduce how many repetitions you're doing into different sets. So if what you're doing is like, okay, I'm going to do 15 squats, but your body sort of fails or becomes unstable as you're doing it, can you do 3 sets of 5, and then kind of in between each set of 5 you just kind of reset, re-engage those muscles, refocus, and then carry on? Or even, do you have to do 15 sets of 1 repetition? Each and every repetition kind of requires your focus and your thought on what muscles are engaging at what point. And I always tell patients, who are kind of working on different things, so your thought and what you're exercising might shift a little bit. So as you're doing squats, you might not be kind of really focusing on your legs and kind of pushing through your legs. This might now become a pelvic floor exercise or a core exercise as you're going, because you have to focus on those muscles prior to the movement starting. Reducing impact, so certainly jumping, it's very hard on our bodies. It just takes a lot of again, strength, power, coordination to control and stabilize for that impact. So if you're doing like jump roping or running or box jumps or things like that, can you modify it in a way that you have maybe a less high jump, a softer landing? Again, you might have to sort of like think about what muscles you have to engage prior to jumping and into that landing. Again, maybe breaking it down into single repetitions or small chunks of repetitions, so you can really kind of focus on what muscles need to kick in and when. Always focus on quality over quantity, kind of no matter what you're doing, but especially with these things, you just have to really focus on how well you're performing that movement pattern all the way through on every single repetition, because if you start really good but then kind of lose form as you go, again, you're just sort of setting yourself up for that risk of injury. And just to sort of throw it out there, I kind of keep saying risk of injury, but what are those risks? So certainly you can make it worse if you kind of go from, not that frequently I have, a little sneeze when I cough. It could become like every day, multiple times a day. You might have to actually start wearing pads, if you're not already, as you're working out or as you're going throughout your day-to-day, because you're just leaking so frequently. Or even potentially, soon or, more down the line, the biggest one that kind of gets my attention is pelvic organ prolapse. So that's when the muscles in your pelvis, basically the pelvic floor, which should stabilize and hold everything up and in, starts to fail, and those organs are actually start dropping down, drooping down into those openings. So your bowels, your uterus, your bladder, all those things can kind of start bottoming out, quite literally. And that's, as I kind of, I've been learning more and more about all these things, I'm like, no matter what, if I'm leaking, I'm like, I just want to keep my organs inside my body. So, just kind of take care of it when it's not a big issue, so that it doesn't evolve into a big issue down the line. And then certainly, abdominal hernias, again, if there's a big opening and a separation, the role of our abdominal walls, again, to keep all those organs in and in their place where they should be, as well as stabilize our, foundation for movement as we're moving our arms, legs, things like that. Also, sometimes this can kind of set you up for a low back injury, a hip injury, just other things that could happen because your body is not performing in the way that it should. So that was just kind of a quick taste. Obviously we can kind of go into all sorts of different examples, very detailed, things that these are associated with, how you can fix it, what you need to do. But I just kind of wanted to give you guys just sort of a big overview highlight of what that is. If you weren't already familiar, or maybe had just a little like, okay, I know the name, I kind of know what it is, but I don't know why it's a big deal. Everyone has it. So hopefully that kind of gave you a good hint for all those things. And do you guys have any questions?